Well, good afternoon. I hope you're doing well. We are coming to you today as a group to share some information and a few changes that everyone needs to know related to our quarantine plan and criteria. With me today are our medical director, Dr. Kahn, our associate medical director, Dr. D'Onofrio, Dr. Parker from our wellness program, James Gartland, our lifeguard chief, Chris Vanos from Local 911, as well as Connor Robbins from Local 911. And here earlier today with us was Jesse Connor from Local 145. We're filming at Fire Station 1 and they just got a call, so he will join us here shortly. As we've said from the beginning, the situation and information with this pandemic evolves every day, which means that we need to be flexible while still maintaining the health of our personnel and the services that we deliver as top priorities. The changes we are announcing today align with the practices the rest of the fire agencies and health organizations in San Diego County, as well as throughout the state of California, are already following. Each of us here today work closely and in partnership to provide you with the information, the equipment, and the support network that you need to operate and be safe out there. You are our top priority, and we are united in our efforts to ensure that you can operate as safely as possible under the circumstances of this national crisis. Here's to speak to some of the changes now are our medical director, Dr. Kahn, and associate medical director, Dr. D'Onofrio.
Thank you, Chief. We're here on a battlefield with an invisible and infectious opponent, and our teams have been working around the clock in order to prepare for this next stage in the war. We have been and will continue to be in communication with other city officials, with agency medical directors from other San Diego County EMS agencies, folks from around the state, from around the nation, and around the world, because we want to keep up with the best methods to tackle this opponent. Initially, our goal was to keep COVID-19 out of the city. But now we have community-based spread in San Diego, and that means that our tactics are changing. We're working very closely with all of the DICOs, along with wellness and occupational health, and we've been preparing for this next step. We're all in this together. You are our number one priority. So starting tomorrow, Thursday morning, we're going to begin a process that other agencies and hospitals have already employed, both here in San Diego, around the state, around the country. And this is a process supported by the Governor's Executive Order, the Centers for Disease Control and Prevention, the County of San Diego, and the California Department of Public Health. If you are asymptomatic, if you have no symptoms, you will be allowed to continue to work. The department will no longer be placing you on quarantine or administrative leave. So all asymptomatic personnel will be self-monitoring and report any changes in their health status immediately. Now, I want to emphasize, if you are symptomatic, if you're even a little bit symptomatic, please do not go to work. The reporting process remains the same. The DICO system is still in place. You have the ability to contact the DICO. And we know this is a change, but we've all worked out on this plan to handle all of the symptomatic personnel, thanks to some great innovation and hard work by the DICO Health and Safety and Wellness team. So here to speak to you a bit more about that is our Wellness Medical Director, Dr. Parker.
As you have figured out, COVID-19 is now community-based. It's community transmission. And so it is going to be everywhere. Assume that the people you're dealing with have it. Assume, for the courtesy of others, that you might have it. So be careful with your families, be careful with your friends, keep your social circles very, very tight. And remember, keep washing the surfaces, keep washing your hands. Hygiene is paramount in terms of keeping this spread under control and flattening that curve that we've all heard about. So it's important to remember to stay home if you're sick. If you are sick, please just call your designated infectious control officer, report your illness. That officer will call San Diego Sports Medicine, and we will evaluate you and treat you and test you appropriately. And when you've been without symptoms for 3 days, we'll send you back to work. What's really important for you to remember that just like doctors and nurses have a duty to treat and care for patients who are sick, you folks as public safety personnel have a similar duty to go about your emergency response to people who are sick. If you use the appropriate protocols given to us by the CDC and by our local public health officials, we'll all get through this and we'll all do just fine. When we have personnel with limited exposure who are asymptomatic, it's inevitable that we're going to have these exposures. At this point, when we're asymptomatic, it's not time to isolate or quarantine. We need to stay on the job and continue to work unless we become symptomatic. It's super important to know that we're going to get through this. We're all going to be in this together. Young people are going to do just fine with this illness. All of you are you may get sick. We'll take great care of you, and we'll make it through this together.
So as the fire chief mentioned, this model is consistent with the rest of the agencies in the county. Nobody is quarantining their folks until they become symptomatic. With that said, though, we are concerned about our members' families out there. And so if you have high-risk family members or unique circumstances, please communicate those through the chain of command. Chief Stoll has given me his assurances that they're all being considered on a case-by-case basis. As some of the doctors mentioned, the reporting process and the protections for our members do not change. They will remain the same. So I can't stress that enough. I want to thank the fire chief for including Local 145 in on all these discussions. I, of course, am out here in operations getting to experience the policy decisions firsthand. We have Vice President George Duardo on the IMT. So please, if you have questions, run them by either of us. And remember, if you become symptomatic, whether on duty or off duty, please contact the DICO through ECDC, and they will help guide you through this sometimes confusing process. Thank you for your work.
Hello. We want to remind everyone, this is an evolving emergency that requires flexibility and adjustments to tactics. We expect the challenges to continue over the coming weeks, and we expect the plans to change. Please know that during these adjustments and changes, your safety and well-being is our top priority. Continue to take care of yourselves, each other, and your families. Continue to adapt and stay positive. Please continue to stay current on the information and updates and take all precautions recommended by the health and safety officers. Thank you.
Hello, my name is Chris Vanos with Teamsters Local 911. We're here to talk about the COVID-19 virus and how the department and the unions are working together to make sure and ensure the safety of all personnel and members. During this time, we ask that you stay positive, work with each other, and take care of each other. And all future updates will come through the chain of command or your union reps or stewards. Thank you.
Well, first of all, I'd like to welcome back Jesse Connor from the call they went on for this closing. So thank you for joining the group. This change to our quarantine procedures was not easy, but continuing to quarantine numerous personnel who are asymptomatic based solely on exposure to a sick patient or a sick coworker is not sustainable for us to continue staffing at a level to provide the services our communities demand. Again, our criteria for quarantine will now be in alignment with all other fire and health agencies trying to maintain service and staffing levels. I hope it's clear, but just in case, I want to reemphasize it. The protective measures are still in place, including authorized leave and optional lodging during isolation for anyone who is experiencing COVID-like symptoms. And they will remain in place as a safeguard for you, your coworkers, and your family. We have come to you as a group to show our unified support of this plan and to assure all of our members that unique high-risk circumstances will be handled appropriately and in your best interest. Questions should continue to be routed through the chain of command and through the DICO. Again, thank you for watching, and thank you for all you do, and stay safe out there.